This video's aim is to help if you are suffering with a lateral ankle sprain. Lateral ankle sprain. A lateral ligament sprain of the ankle can occur when you invert, which is to roll over or go over on your ankle. Pain is usually felt on the outside of your ankle, around the bony lump of your ankle joint. Swelling can occur immediately, and you may not feel like you can put your weight through your foot. What are the symptoms? Pain on the outside of your ankle, swelling on the outside or all around your ankle, inability to put weight through your foot, restricted range of movement of the ankle, heat around the ankle, bruising, a lateral ligament sprain can be diagnosed by your GP or physiotherapist from the presentation of your symptoms. Occasionally an X-ray is needed to rule out a fracture, which is a break of the bone. Sprains are graded in relation to their severity. Grade 1 is a mild stretching of the ligament without causing joint instability. Grade 2 is a partial rupture, which is a partial tear of the ligament, but without causing joint instability. Grade 3 is a complete rupture, which is a complete tear of the ligament causing joint instability. Only Grade 1 sprains will heal by themselves in a few weeks if you follow the price guidelines below. Most Grade 2 sprains will settle completely with intervention from a physiotherapist. Grade 3 sprains will need medical attention, so you must go to A&E. So how can you help yourself? Immediately follow the price guidelines. Protect the ankle. Rest the ankle, i.e. do not continue to play sport on it, consider the use of crutches. Ice the ankle, apply ice for no longer than 15 minutes at a time and always wrap the ice in a towel to avoid skin damage. Compression of the area will help to limit swelling. This should not stop blood flow. Elevate the foot to help limit swelling. For the first 72 hours you should also avoid heat, alcohol, running, massage to the area. If the pain in your ankle is too severe to walk on, or if you have severe pain over a bone, or you suspect a fracture, you must go to A&E. If the pain does not ease after a few days, consult your GP. What is the treatment if the pain persists? Physiotherapists are trained to treat lateral ankle ligament sprains. In the early stages, we will use treatments to help to reduce the inflammation, pain and aid healing. Following on from this, we will also tailor a rehabilitation program to strengthen the muscles and ensure stability of the ankle joint. This will help to prevent reoccurrence of the injury. Early on, your calf and Achilles can shorten, so you need to stretch them. You should start these after 72 hours and gradually push them harder as the injury tolerates and heals. Calf stretch, gastrocnemius. To stretch the right leg, take a long stride forwards with your left leg. Keep both of your feet pointing forwards. Now, while keeping your back knee straight and your back heel in contact with the floor, start to bend your front knee and lean your body forwards until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. Calf stretch, soleus. Take a long stride forwards with your left leg. Keep both of your feet pointing forwards. Now, while keeping your back heel in contact with the floor, start to bend both knees and lean your body forwards until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. The ankle itself also needs stretching. Dorsiflexion. Sitting in a chair, prop your foot up on the opposite knee. Now take hold of your foot with both hands and pull the foot and toes up towards your shin and hold for 10 seconds. Repeat twice and swap legs if required. Plantar flexion. Sitting in a chair, prop your foot up on your opposite knee. Now take hold of your foot with both hands and pull the foot and toes down so that they are pointed and hold for 10 seconds. Repeat twice and swap legs if required. Inversion. Sitting in a chair, prop your foot up on your opposite knee. Now take hold of your foot with both hands and pull your foot around so that the sole is turning up towards the ceiling and hold for 10 seconds. Repeat twice and swap legs if required. Eversion. Sitting in a chair, prop your foot up on your opposite knee. Now take hold of your foot with both hands and pull the foot around so that the sole is turning down towards the floor and hold for 10 seconds. Repeat twice and swap legs if required. Next, you need to stretch the lateral ligaments. Sitting in a chair, prop your foot up on your opposite knee. Now take hold of your foot with both hands and pull the foot around so that the sole is turning up towards the ceiling. At the same time, pull the foot into a pointed position and hold for 10 seconds. Repeat twice and swap legs if required. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. When things are improving after a couple of weeks, you can start to train the perineal muscles. Manual resisted eversion. Sitting in a chair, prop your foot up on your opposite knee. Now take hold of your foot with both your hands so that you can apply pressure on the outside of your foot. Start with your foot in the position with the sole facing towards the ceiling. Now turn your foot so that the sole of your foot is facing down towards the floor. Keep the pressure on the outside of your foot in the opposite direction of the movement. Now reverse the direction of the foot, but maintaining some pressure on the outside of the foot. Repeat 10 times and swap legs if required. After 3 weeks, you can start to train your proprioception. Single leg balance. Stand on one leg with your knee unlocked. Try to hold this position for 1 minute and count how many times you need to put your leg back down. If you can do it for a whole minute, then try to make it harder by doing it while throwing and catching a ball, and harder again when required by closing your eyes. Repeat for each leg if required. When your symptoms are settling on a day-to-day basis and you have improved with these exercises, then you need to progress into pain-free resistance training. For example, squats, lunges and calf raises. Start with body weight and gradually advance the resistance level. The next phase on is light plyometrics and then into a little running. As long as there is no pain during and after, then you are training it at the correct level. If you feel any pain, then drop back to the previous progression. After 12 weeks, you should hopefully be getting back into normal sporting activities. Remember, injuries take time to recover and do so gradually, so be patient, there are no miracle cures. Physiotherapists are trained to treat lateral ankle sprain. They use evidence-based techniques such as deep tissue friction massage, ultrasound, acupuncture, and an exercise program which can help to settle symptoms and aid the healing process.